Hello, my name is Raval. Today I am the trainer and he is my client.
Hello, my name is Ashutosh Trivedi.
So today we are performing the stretches of lower limbs. It is basically for the football players. So we are including all the major muscles, that's the hamstrings, iliacus, psoas major, quadriceps, the dorsiflexus and plantar flexus. Yeah, so we are performing the first stretch here. The patient position should be in prone. Yeah, the towel should be placed below the knee, and patients, the limb should be, which is going to be stretched, should be flexed. The therapist position, the hand position, one hand is stabilizing the pelvis and the other hand is grasping the knee and giving a little bit stretch in upward direction. Do you feel stretch?
Yeah.
Start. So now we are performing stretch for the ankle dorsiflexors. The two primary muscles involved are soleus and gastrocnemius. So to isolate the muscles, we are doing first the soleus. So for this, patient is in prone position. Patient's knee should be flexed. Towel should be below knee. And therapist grasping his heel and giving downward pressure. Patient will feel stretch in his calf muscles. This is basically soleus. Do you feel any stretch?
Yes.
Start. So now we are performing the knee extensile stretch. The primary muscles are quadriceps. For this, patient position should be in prone. Patients, we have to place towel below patient's knee and we have to flex the knee to the end range. Patient will feel stretch in the quadriceps muscles. Do you feel any stretch?
Yeah.
So we are performing the stretch for hip abductors. The muscles involved are gluteus medius, gluteus minimus and tensor fasciae lata. For this, the patient position is in supine and one hip should be flexed and knee to chest position. Therapist giving pressure in the direction of opposite shoulder. And make sure the other knee is fully in extension. Do you feel any stretch here?
Yeah.
So we are performing the stretch for the knee flexors. The main muscles are hamstrings. So we are performing the terminal stretch of hamstring. For this, patient position should be in supine. Towel should be placed just below the knee. Therapist holding, grasping the ankle of that limb and stabilizing the proximal thigh, giving the terminal pressure to the hamstrings. Do you feel any stretch?
Yeah.
So now we are performing the stretch for the gastrocnemius, the isolated muscle from the calf. So for this, patient position is in supine. Patient's knee should be properly fully extended. Therapist grasping the heel and giving stretch in the direction of the head. Do you feel any stretch in the calf muscles?
Yes.
Yeah. Stretches for the hip adductors. The primary muscles involved are adductor magnus, adductor brevis and adductor longus. So for this, patient position should be in supine. Therapist grasp his leg with his hand and pull towards his body. Make sure one limb is fully extended and straight and we have to stretch the other limb. It should not be in flexion, it should be properly in abduction position. Do you feel any stretch?
Yes.
For hip extensors, the muscles is hamstring. For this, patient's position is in supine. Therapist should hold the stretched limb on his shoulder. Make sure the knee is in full extension and stabilize the other limb. Do you feel stretch here?
Yeah.
So now we are performing the last stretch of this stretching session. So this is the stretch for the ankle plantar flexors. The primary muscles involved are tibialis anterior. For this, patient's position should be in supine. Patient's knee should be properly stabilized with a towel. Even we have to support his calf muscles here. It should be within a normal length and we are giving stretch to the tibialis anterior here. Do you feel any stretch?
Yes.